digital pathology trailblazers, reporting to you live from the National NCCN Summit. So today I'm in Washington, D.C. in the National Press Club, Washington, D.C., reporting from the one of the Policy Summit series meetings. And this one, I got invited to cover it because it's about the evolving artificial intelligence landscape in cancer care. And if you are here, and I see that people are here live, let me know if you can hear me and if you can see me. I'm not sure if the chat is working, but if you just want to let me know that you're there, maybe it's going to go through. It didn't go through yesterday when I was streaming, but what we're going to do today, I'm basically going to cover this event for you. So let's start with NCCN. What is NCCN? National Comprehensive Cancer Network. This is a nonprofit that is basically guiding the cancer care in the world. And I'm going to give you more details about what's happening here and also about NCCN. I just got my press kit, so I'm going to definitely learn a little bit more and give you the important details about the organization, about the mission of these summits in our second live stream. We're going to have 3 today. We're going to have this one. It's just opening, welcoming you to the event. And then we're going to have one midday and one at the end of the event. And hopefully I can get somebody to join me for one of them from NCCN. I started negotiating who could be joining us to tell us more about this. But so NCCN, the nonprofit that's basically guiding the cancer care in the world. What do I mean by that? You may have heard about the NCCN guidelines, the guidelines for cancer care that are being constantly updated. This is super important for all the states who want your tests to like be recognized by other stakeholders, then you want to be in those guidelines, and it's not easy to get there. Honestly, I semi-witnessed the process of trying to get these a test into these guidelines when my husband was working for a company that was trying to include the test there. I don't remember if they finally succeeded or not, but I know it was a pretty cumbersome process. So if a test is in the guidelines, it has proven, it's proven scientifically there is medical necessity and all the necessary things to actually bring benefits to cancer patients. So what's going to happen here, oncology and cancer care stakeholders are going to meet. They're pretty high level people. And let me just tell you who is supporting this. So obviously, pharmaceutical industry is very much involved here. So I'll show you later because I don't want to waste your time by looking for stuff. But and here we're going to be talking about AI in cancer care. So why does it matter? Let me look at my notes I prepared for this. Yeah, so what's going to be covered, it's going to be integration of care. So obviously, you know, we all have access to AI, ChatGPT, and all that stuff, and it's being already used in some aspects of care, but we're going to be talking, and the stakeholders are going to be talking about the challenges and importance of connecting primary care with oncology. This is one of the missions of these summits, to have obviously oncology and is like the specialist, and you need to be connected with your specialist by your primary care physician. Where are we not doing our best? How can we connect this better so that this care happens faster, better, up to the standards? Then they're going to be discussing policy barriers. This is a policy summit series, so it's very much heavy towards policies. They're going to be discussing that. They're going to be mentioning ongoing gaps in regulations. Reimbursement is always a big thing in the American healthcare, and obviously implementation. And then when it comes to AI, uh, in general, when it comes to healthcare, equity and access, right? Equity and access is, I don't know, I would call it even like an ethical problem, dilemma in the world. And now we have AI on top of this. Equity in access to AI, equity in the AI performance, meaning how do we address biases? How do we collect data, build these tools so that we can provide equitable access to them, and role of AI in oncology. So me being a pathologist, obviously, I'm very familiar with the image analysis aspects and the diagnostic support, the computer-aided diagnostic aspect of this in diagnosing based on whole slide images. But there is a lot more to AI and a lot more to oncology than just this point of diagnosis, which obviously is a super important one. I believe digital pathology is the gateway to fast diagnosis, and this is why I'm teaching healthcare professionals about digital pathology so that we can increase access and speed to care. But AI is a lot broader. So we're going to be highlighting here how is AI moving from research into real-world clinical application, starting with note-taking. And I see people coming in, so I'm going to be wrapping up myself here, but because we are actually starting in 4 minutes. In 4 minutes, there's going to be the welcome, and just quick recap why it matters. Obviously, for the patients, the patients need to be empowered, need to be in the center of things like that. AI has advantages and disadvantages. We need to be super cautious not to cause more harm than nobody's joining me at the table because they see I'm streaming. But hopefully they join me when I switch off the camera. And obviously the policies, because okay guys, I see you next time around 12 o'clock. Look on LinkedIn and other social media and your email if you're on my list to check when the next live stream is gonna be. See you later.